Introduce Rajiv Jauhar here from New York here to complete the picture that Ari introduced with deliverability.
Good afternoon. If you can't get the stent to its target lesion, this has no value. And the characteristics of this novel system, I have no disclosures by the way, unfortunately, are based on several factors. One is the stent, but two, which is most fascinating, is the Flexx catheter. How many times have we done an angiogram, an angioplasty, where you're pushing, and then the transition between the proximal and the distal part of the tube kinks because it's at the weakest point, and then you have to take the whole thing out and start all over again. Well, with the Flexx² catheter, with the reinforced hypotube, with its transition element, and its silk-like hydrophilic coating, the deliverability of the stent and the translation of the push to the stent is of paramount importance. The spring tip, which has already been mentioned, is flexible, pushable, does not kink, and it tracks along with the wire extremely well and provides an impressive crossability. And with the profile of the stent, it makes it very easy to use. I'll present two cases today. In the interest of time, I'll go very quickly. It's a 56-year-old female who has risk factors of diabetes and hypertension and a very strong family history of CAD, who developed a typical class 2 angina and a positive stress test with significant ST depressions. And the angiogram done shows a significant lesion in the right coronary artery in a tortuous vessel with a mid and distal lesion that after balloon angioplasty had a dissection distally, but still had a significant lesion in the proximal and mid segment. After 3 EluNIR stents, you had a terrific result, and the patient was discharged 48 hours later. We did a case last August of a 67-year-old gentleman with a history of hypertension, hyperlipidemia, who presented with chest discomfort on exertion, had a large basal inferior and mid inferior reversibility on a stress test, and was sent over to us for an angiogram. The first shot of the right, with not good engagement, shows a mid lesion with a tortuosity in the proximal segment. After pre-dilatation, a 3/24 EluNIR stent was placed with a terrific result. We saw this patient in the office a couple of weeks ago at about 14 and a half months, was clinically doing terrific, had no further chest pain, and felt great. In terms of my personal experience, we found it in our hospital. We enrolled about 57 patients, Dave?
It's amazing. Yeah.
57 patients in this study. And I must tell you, there was an initial apprehension to trying something new. As everything in life, there's always that inertia of trying something new. But that initial apprehension was quickly mitigated after doing a few cases because of the deliverability of this stent. There was really no difficulty in crossing difficult lesions. My colleagues were very impressed with the Flexx catheter. There was some difficulty in visualizing the stent after deployment, but we felt overall this was very similar to the handling of the new generation DES stents, which I feel is a very positive thing. So we were happy to be part of this trial. We were happy to use this stent, and the science to the data to the deliverability is of what's paramount importance, and the transition you saw today with Yoram's talk, then David's talk, and then the rest of our talks. So I want to thank everyone for letting me speak.